going to put a vest restraint on Mrs. Smith. This is one of the most frequently failed skills in the state of Ohio. If you're asked to perform this skill, this is how you should do it. Good morning, Mrs. Smith. My name's Sandy. I'm your nursing assistant today, and I'm here to put your safety vest on. Let me go wash my hands. I'll apply the bed breaks. And I'll pull the privacy curtain all the way around the bed. And I will need to get the bed up to working height, but before I do, I want to make sure that I apply the proper size vest restraint. So I've gone to the chart and I've looked up her weight, or the nurse has told me her recent weight, and I then have to make sure I have the proper size vest restraint. So I consider her weight, and I take the manufacturer's instructions, and I find her weight on the manufacturer's instructions, and I get the proper size vest restraint according to how much Mrs. Smith weighs. So Mrs. Smith weighs 110 pounds, and she takes the red vest restraint, or the small vest restraint. So I collect my vest restraint, and before I put it on Mrs. Smith, I want to make sure that it's a safe piece of medical equipment. So I'm going to check it for rips, sprays, and tears. And if you find any rips, sprays, or tears on this restraint, you shouldn't use it on Mrs. Smith. This restraint looks good. There are no rips, sprays, or tears in this restraint. Well, I never work over my side rails, so I'll put my side rails down, and I'll get the bed to working height. How are you, Mrs. Smith? It's going to be a pretty day out today. I can raise Mrs. Smith's head a little bit, but when I'm finished, I want her to be in the semi-Fowler's position. I'll help her put on her vest restraint. All right, Mrs. Smith, we're going to lean you forward for a second. 1, 2, and 3. Put that behind her, and I'll make sure there are no wrinkles in the vest or in her gown, because she will be wearing this for about 2 hours, or according to her care plan. I'm going to raise you up one more time, Mrs. Smith. Vest restraint. There we go. And we'll put the strap through the slit in the vest restraint. And that's the proper way to apply it. You want the vest restraint to be tied at waist level. And we're going to tie it to the movable part of the head of the bed. And we're going to make a quick release knot when we tie it. Strap in the restraint bracket, check it for tightness, and tie my quick release knot. And tuck the straps underneath the mattress. Raise your side rails on this side of the bed. The other side of the bed, and again take the second strap, put it in the restraint bracket, check it for tightness. And tie your quick release knot. Your goal is to be able to get a flat hand between the patient and the restraint. When you've got your knot tied, tuck it under the mattress. Again, check it for tightness to make sure you can get one flat hand between the restraint and the patient. Lower Mrs. Smith so that she's in the semi-Fowler's position. That's raising the head approximately 30 degrees. And check to make sure you have her in the proper position. Raise your bed rails on this side of the bed. Cover to the restraint only. Don't cover your restraint. It has to stay in plain view. Lower the bed. Make sure she's comfortable. Is there anything else I can get for you, Mrs. Smith, before I leave? I'm going to bring your bedside stand over. And I'll make sure that you've got your water pitcher, your cup, your remote control, your crossword puzzle, everything else you need. I certainly don't want to leave her without giving her the call light. Back to her pillowcase so she doesn't lose it. Is there anything else I can get for you, Mrs. Smith? I'll be back in 15 minutes to check on you. Open the privacy curtain and wash my hands. I'd like to give you a couple of reminders. First of all, when you're putting a vest restraint on, never put a pillow behind your patient's back. And that's not just a pillow, but also a wedge or a cushion of any sort. The patient may be allowed to have a small, thin pillow underneath their head, but check with your nurse first. Also, at the end of the vest restraint skill, you should always leave the side rails up. And we do that because that's part of the manufacturer's instructions. So when you leave this skill at the state test, be sure you put the side rails up. Good luck, everybody.